Knock, knock. Can I come in?
Yes, you can.
Hi, I'm Terry, and I'll be your nurse today.
Hi, Terry.
Hi. Today we're going to be doing your head-to-toe assessment. It should take between 10 and 12 minutes, okay?
Okay.
All right. So now I'm going to close the curtain for privacy and wash my hands. All right. And we're going to start off with your name and date of birth.
Terrell McLovin, 9/21/93.
Okay, Mr. McLovin, I'm just going to check your wristband.
Okay.
Okay, good. And can you tell me the city and state we're in right now?
Chicago Heights and Illinois.
Okay. And can you tell me the date today?
June 5th, 2021.
Okay, good. So patient is Orient Alert ×3. Speech is clear, posture is relaxed, and hygiene is appropriate. Okay, so now we're going to start off with your head, okay?
Okay.
All right, I'm going to be checking it for lesions, bumps, or parasites.
Okay.
Okay, and while I'm doing this, can you tell me if there's any tenderness?
There's no tenderness.
Okay, no tenderness present, no lesions, bumps, or parasites. Okay, so now I want you to close your eyes. And now I want you to tell me where you feel my hand touching on your face, okay?
Okay. My forehead, my left cheek, my right cheek, and my nose.
Okay, good. You can open your eyes back up. Now, can you smile for me? And frown. And puff up your cheeks. And raise your eyebrows. Okay, cranial nerves 5 and 7 are intact. Now, I'm going to check your eyes.
Okay.
All right, so I want you to look at my nose. Okay, no redness or drainage present. And now I want you to follow my pen, just your eyes. Okay, cranial nerves 3, 4, and 6 are intact. Now I want you to cover up your right eye. Good. And I want you to tell me how many fingers I'm holding up.
2, 2, 2.
And can we switch eyes?
Okay.
Good. Now.
2, 2, and 2.
Okay, cranial nerve 2 is intact. Now I'm going to check your nose, okay? All right, no drainage or deviation present.
Okay.
Now I want you to cover up your right nostril, breathe in and out. And cover up your left nostril, breathe in and out. Okay, good. Now I want to check your mouth, okay? Can you open your mouth for me? Okay, tongue and uvula are midline. Mucosa is pink and moist. Now, I want you to swallow. Okay, good. Cranial nerve 9, 10, and 12 are intact.
Okay.
Now, I'm gonna check your ears, okay? Okay, no excessive cerebrum, no excessive drainage, and no lesions are present. Now I want you to close your eyes, and I want you to tell me which side can you hear a sound, left or right, okay?
Okay. My left ear, my right ear.
Okay, good. So cranial nerve 8 is intact. Now, I want you to turn your face towards my hand. Okay, good. And turn your face towards my hand. Okay, good. Now, can you shrug for me? Okay, good. So cranial nerve 11 is intact.
Okay.
All right. And anterior, posterior. Transverse ratio is 1 to 2. Respirations are 16 breaths per minute. Breathing is normal. Depth is adequate. No accessory muscle usage present. And there is no cough present. Okay. So now, Mr. McLovin, I'm going to check your lungs, okay? So I'm going to have you turn to the side.
Okay.
And I'm going to check 6 in the back, 6 up front, and 2 on each side, okay?
Okay.
Okay, can you turn forward for me? Okay, good. Your lungs sound good. Air is passing freely.
Okay.
All right, so now I want to check your heart sounds, okay?
Okay.
All right. Aortic valve, right intercostal space, right sternal border. Pulmonic valve, second, left intercostal space, left sternal border. Erb's point, third intercostal space, third sternal border. Tricuspid valve, fourth intercostal space, fourth sternal border. And mitral valve, fifth intercostal space, mid-clavicular midline. All right, and now I'm going to listen to your valve sounds, okay? So can you lie back for me?
Okay, great. Okay.
Okay, bowel sounds are equal in all 4 quadrants and can be heard in all 4 quadrants. And I'm going to palpate for any tenderness, okay?
Okay.
Tenderness?
Nope.
Tenderness? Tenderness?
Nope.
Tenderness?
No.
Okay, good. I'm going to have you sit up. And I'm going to have you turn to the right for me. I just want to check your spinal column for alignment. So can you lean forward for me? Okay. Spinal column is aligned, and I'm going to percuss for any tenderness, okay? Any tenderness? Any tenderness?
No.
Any tenderness?
No.
Okay, I'm going to place both of my hands right here to check for thoracic expansion. So can you take a deep breath in for me and out? Okay, thoracic expansion is equal. You can sit up, Mr. McLovin. Okay, so can you turn forward for me? All right, now I'm going to check your pulse, okay?
Okay.
Carotid pulse is 2+. Okay, I'm going to check your radial pulse, your brachial pulse, your popliteal, your anterior tibialis, and your dorsalis pedis. Okay. Now I'm going to palpate your skin for your extremities, I'm sorry. I'm going to palpate your extremities, okay?
Okay.
Okay, extremities are warm to touch, are dry, and are free of any lesions. Okay? Any tenderness?
No.
No. Okay. So now I want you to stand up.
Okay.
And I want you to turn that way and walk 3 steps that way for me. Okay, now turn around and walk 3 back. Okay, gait is normal. Now I want you to close your eyes. Put your hands to your sides. Okay. Romberg test is negative. You can open your eyes. Okay, I'm going to have you sit down, okay? All right. Now I want to check your capillary refills. Can you put your hands out for me? Okay. Okay, check your toes. All right, so capillary refill is less than 2 seconds. Now we're gonna check your strength.
Okay.
Okay, so can you put your hands out for me? And push up against my hands. And push down against my hands. Okay, good. Now with your legs, push out. Okay, now pull in. Okay, now with your feet, lift up. And down. Okay. Now, I want you to stand up for me. And I want you to put your arms out. And we're gonna do range of motion. So I want you to do circular motions. Okay, now can you lift your right leg and turn your right foot? Okay, good. And can you lift your left leg and turn your left foot? Okay, good. So range of motion is equal. All right, Mr. Smith, you can have a seat. Okay, Mr. McLovin. All right, Mr. McLovin. I'm just gonna wash my hands. Okay. All right, so I'm gonna go out and document all of my findings. And if you need anything, I'll be out in the hall, okay?
Okay.
Thank you.
You're welcome.